If you're a doctor thinking about applying to specialty training, chances are you're going to need to sit the multi-specialty recruitment assessment, otherwise known as the MSRA. And despite what people might think about its usefulness, more specialties than ever are actually using it as part of their application process. The problem is, each specialty uses it in a slightly different way, and this can be confusing for applicants. Hi, my name's Colin and I'm a junior doctor working in the UK, and fairly recently I had to sit the MSRA. In this video I'm going to go through what the MSRA is, the exam structure, the different types of questions you can get, how the exam's scored, and my own experiences of sitting this assessment. The MSRA is a computer-based exam that doctors are required to sit if they're applying for a variety of specialty training posts. Different specialties use it in different ways. For example, with the GP training application, it makes up 100% of the application process. That is to say, how you rank on your GP application is based solely on your MSRA score. Other specialties, such as anaesthetics, use scores from the MSRA to give candidates interviews, but once the interview's done, the MSRA is weighted at 15% of the overall application, whereas the interview itself is worth 85% of the overall application. Because each specialty uses the MSRA in slightly different ways, it's important to make sure you look up how the specialty you're applying for is going to use it, and I'll leave a link to the National Recruitment website in the description down below. And although this does change, currently the specialties that are using the MSRA as part of their application process include general practice, psychiatry, radiology, ophthalmology, obstetrics and gynecology, community and sexual and reproductive health, neurosurgery, nuclear medicine, ACCS and emergency medicine, anaesthetics, and core surgical training. So arguably, most specialties. But do check on your specific specialty training programme, because specialties do have a tendency of changing their mind about whether to introduce the MSRA examination or not. And an example of this is core surgical training recently introduced it last year without giving candidates much notice. It was at the last minute, and they then had to go away and sit this without much time for revision. To put it simply, there are two parts to the exam. There's a clinical problem solving paper, CPS, and then there's a professional dilemma paper, PD. The way I think about it is, arguably, a more simple way to put it is the clinical problem solving paper is there to test your sort of clinical knowledge at an F2 level, whereas the professional dilemma paper focuses more on ethical scenarios and professional scenarios. And it's kind of like the SJT you sit if you're applying to foundation training programme when you graduate from a UK medical school. The clinical problem solving paper lasts for 75 minutes and it's worth 86 marks. However, 11 of those marks aren't actually going to count. They're basically pilot questions, but you won't know which ones are the pilot questions and which ones are the real questions, so you just have to answer them all best you can. As per the Health Education England website, the CPS questions are based on 12 clinical topics that are relevant to general medicine. I'd argue that they don't all relate to general medicine, as you cover topics like paediatrics or ENT and ophthalmology. And the list on the HEE website includes cardiovascular, dermatology, ENT, ophthalmology, endocrinology, metabolic medicine, gastroenterology, nutrition, infectious disease, hematology, immunology, allergies, genetics, musculoskeletal, paediatrics, pharmacology and therapeutics, psychiatry, neurology, renal and neurology, and reproductive and respiratory. Theoretically, they're all supposed to relate to working as an F2 doctor, but you're definitely going to want to do some revision for this exam, because it's in all likelihood you've not covered all these specialties. You've only got 3 rotations in your F2 year, so you might not have covered ophthalmology or obstetrics and gynecology for a long time, likely since you're in medical school. You're going to want to brush up on your knowledge. Whilst it says it covers 12 clinical topics, it's actually a lot more because they've grouped some specialties together. For example, neurology and psychiatry, or ENT and ophthalmology. So you do have to do quite a bit of revision for this assessment. The CPS section also covers 5 domains, which the different specialty questions will be based upon. And these include things like investigation, diagnosis, emergency situations, prescribing, and management of patients, which involves non-prescribing sort of situations. The professional dilemma paper. This isn't here to test your clinical knowledge, but rather your professionalism and your ethics. This part of the MSRA is made up of 50 questions. Again, 8 of them are pilot questions, but you don't know which ones are which, so you just have to answer them all again in the given time frame. For this, you'll have 95 minutes to answer the questions, and the PD paper covers 3 domains, and these include professional integrity, coping with pressure, and empathy and sensitivity. So when you go to sit the exam, you'll be sat at a computer and the paper begins with the PD questions. There are 2 question formats that you can be asked. The first type involves you being given a scenario, and the question then asks you to rank the responses in order of most appropriate to least appropriate. You'll be given 5 options to select from. And this is an example that you can see on the Health Education England website. The other type of PD question again involves being given a scenario. You're given a little blurb that you can read through, with the scenario, and then you've got 8 potential responses to the scenario, and then you're asked to choose the best 3 responses. And again, this is the example that they use on the Health Education England website. Then, once you complete the PD paper, the computer will automatically give you a 5-minute break. You can choose to take the break and just sit there or go ask to the bathroom or whatever, and that's when the clinical problem solving questions start, and you've got 75 minutes to answer these. There are 2 types of questions that you can be asked as part of the CPS questions. First type is an extended matching question, EMQ, and this question will give you a scenario, and beneath it it'll have 7 to 10 possible options. Beneath this you'll have questions which give more clinical detail and then ask a question at the end of that. The example that can be seen on the Health Education website is as follows. The other type of question you can be asked is a single best answer question, SBA. These are arguably the most straightforward. You're given a small clinical blurb and then you get 5 possible options to choose from. So you might have a patient who has different symptoms and you're asked to choose the most likely diagnosis for this patient. And this is kind of like the example that's seen on the Health Education England website as well. After the 75 minutes are up for this part of the examination, you're done. You get to leave the Pearson Test Centre. And yeah, I should probably mention that the exams take place in the locations where you sit your driving theory test. So it's kind of annoying because it leads to a bit of a scramble when everyone's trying to book into their nearby test centres. If you're unlucky, you have to travel to the assessment. Some people do have to travel quite far away. Then moving on to your score. You don't get your score on the day and you have to wait until they get released onto Oriel, and that's the website that you apply for specialty training on. The scoring system used in the assessment is pretty complicated to say the least. So each paper is normalised around a mean score of 250 with a standard deviation of 40. A slightly simpler way to see how you've done this to go through the bandings. So basically each paper is divided up into almost quartiles and it tells you which quartile you fall in. So the bottom 25%, otherwise known as band 1, are automatically deemed unsuccessful and your application doesn't go any further. The remaining applicants are split between bands 2, 3 and 4, with band 4 being the highest band. And when you get your score you'll be told which band you've fallen into. Health Education England have released these tables which outline what is considered a good score for each paper, and you can see it here. Some specialties will use a minimum MSRA score required to be given for an interview. For example, radiology last year used a score of 543, a combined score on the CPS and PD, to decide which applicants were offered an interview and which ones weren't. This is becoming increasingly competitive, as the year before the cut-off for radiology had been 521. Another thing to consider about your score is if you're applying for GP training, you can carry your MSRA score over for 12 months. Because the GP training applications are every 6 months, it means if you apply in the first round and do the MSRA exam and you get your score, but you don't accept an offer, you can apply again 6 months later without having to sit the MSRA again. And this is what I'm doing. Now a brief little bit about what my experience of sitting the MSRA exam was like. I'm not going to talk about the exam itself on the day because, well, one, you're not allowed to do that, but I am going to talk about my own experiences of just the sort of morning on the day and then afterwards once I got it done. I had to drive roughly an hour on a Saturday morning to sit my MSRA exam. It wasn't too bad getting there, and some people had to travel a lot further away, but I ended up getting there 40 minutes earlier than I needed to be. However, when I got there, the building was locked and both invigilators were sat outside the test centre. And basically what had happened was the landlord had locked the test centre the day before with a bolt, preventing anyone from entering the building. This has meant we'd had to stand in the rain for over an hour while we waited for the landlord to commute another hour to get to the test centre. I think by the end of it, my assessment started over 2 hours later than it was supposed to, and I was drenched because I've been standing out in the rain. So it wasn't exactly the best start to the exam. Thankfully, the actual exam itself went okay and I was happy with my score. As I mentioned in a previous video, I got an offer for GP training in the last round, but I rejected this, and I'm going to be applying again in July this year using the same MSRA score I got previously. If you'd find a video of me talking about how I studied for this exam helpful, let me know down in the comments below. I might do that in the future. Hopefully this video has been useful, and if it has, please give this video a like and subscribe to my channel. Thanks.